Finally, we're going to be talking about liver disorders, and we're going to be focusing on hepatitis and liver cirrhosis. And let me start with hepatitis. Hepatitis, inflammation of the liver cells, and this inflammation is most commonly caused by viral hepatitis. So let me be very specific. We're going to be talking about viral hepatitis, and the manifestations of acute viral hepatitis have been always the same: jaundice, fatigue, weight loss, jaundice, fatigue, weight loss. And we cannot differentiate based on the clinical manifestations. We cannot differentiate between the different types of viral hepatitis, A, B, C, or E. They all present with the same presentations. Dark urine. In hepatitis B and C, they more likely present with serum sickness phenomena and joint pain, fever, urticaria. Hepatitis E, very prevalent in Southeast Asia. Hepatitis E comes by eating contaminated food. So hepatitis A and E are fecal-oral route of transmission, while hepatitis B and C are parenteral route of transmission. They got transmitted by infected blood and body fluids, and transmitted by these two types of transmission. But A and E, fecal-oral route. So hepatitis E, it comes by eating, prevalent in Southeast Asia, very severe and might even be fatal during pregnancy. Viral hepatitis will increase your ALT level. We have two liver enzymes tests that we always do: ALT and AST. Viral hepatitis will elevate your ALT more than AST, while drug-induced hepatitis will increase your AST more than ALT. Sometimes you ingest some medications, and these medications will harm your liver. And because you have liver cell injury, your liver enzymes are going to be increased. Which one will increase more, AST or ALT? In drugs, AST will increase more. So in alcohol, we get more elevation of AST than ALT, because alcohol, in a way, it's a drug. It's a chemical that alters your body function. Then it's going to be called a drug. Alcohol will increase your AST more than ALT. Statins, the most common side effect of statins is what? Elevation of liver enzymes. Which enzyme is going to be more elevated? AST. So drugs will elevate AST, viral hepatitis will elevate ALT. How to differentiate between the different types of viral hepatitis? We need to do some serological tests to detect some antibody levels. In hepatitis A, hepatitis C, and hepatitis E, IgM levels increase acutely, and then followed by elevation of IgE. The surface antigen, the core antibody, the E antigen, the surface antibodies are done only for hepatitis B. Let me talk about hepatitis B. The first test to become abnormal in hepatitis B is surface antigen, positive surface antigen. And when you have, as long as you have surface antigen, you have the ability to transmit this hepatitis B to others. And chronicity, if this surface antigen persists more than 6 months, this is going to be an indication for chronic hepatitis B. After having this surface antigen positive, the symptoms will develop, and the ALT will go up, and the E antigen will start to show. Chronic hepatitis B, as I said, persistent surface antigen. What's the significance of having the E antigen? E antigen means the high severity, high infectivity. When you have too much E antigen, you're going to be very infectious to others. Your body fluids are full of the virus, your blood is full of the virus, and your blood is going to transmit this hepatitis B virus to others. And how to diagnose hepatitis B, chronic hepatitis B, as I said, persistence of the surface antigen. This table summarizes for you the different antibodies and antigens following a hepatitis B infection. You can review it, but the most important things that I want you to pay attention to, the first thing to become increased is the surface antigen, the first thing that shows in acute hepatitis B, and if it persists more than 6 months, then you diagnose chronic hepatitis B. When it comes to hepatitis C is very rarely to find hepatitis C as an acute infection. Usually hepatitis C follows a kind of less acute course and it always tends to be more chronic. But the best initial test is when you detect the hepatitis C antibody. When you detect the hepatitis C antibody, but this cannot tell you the level of the virus activity. If you want to know the level of the virus activity, the most accurate test is going to be hepatitis C PCR for DNA. You are going to detect the viral load in this patient. Liver biopsy will tell you how much damage or fibrosis you have in your liver. When it comes to the treatment of acute hepatitis, there is no treatment for acute hepatitis B. There is no treatment for acute hepatitis B. For acute hepatitis C, which I said it's a very rare occurrence, the same treatment for acute hepatitis C is the same treatment as for chronic hepatitis C. The same treatment, interferon, ribavirin, and either telaprevir or boceprevir. 3 medications for acute or chronic hepatitis C: interferon, ribavirin, and either telaprevir or boceprevir. For chronic hepatitis B, it's sufficient to treat patients with only monotherapy, one drug of any one of these: lamivudine, adefovir or entecavir or tenofovir. All these are oral medications. Interferon is the only injectable medication, and interferon has a lot of side effects. The most common is flu-like symptoms. When you have the flu, why do you feel this kind of malaise and bone pains? Because you have a lot of interferon circulating in your blood, and the same happens to you when you take interferon as a medication for hepatitis B. So usually we prefer not to give interferon. Usually we use lamivudine as oral lamivudine, as it has very minimal side effects. When it comes to treating chronic hepatitis C, as I said, combination of 3 drugs: interferon, ribavirin, and boceprevir or telaprevir. Vaccination for hepatitis. Now, vaccination for both hepatitis A and B is now universal in children. All children will get vaccinated against hepatitis A and hepatitis B. What are the indications of vaccination in adults? Who needs the vaccination the most? Who needs vaccination against viral hepatitis the most? It's not healthcare workers. You know who needs the most? Patients with bad liver already. When you have a healthy liver and you get hepatitis A, it's not gonna be that serious for you. But when you have a diseased liver and you get hepatitis A can kill you. So adults with chronic liver disease, adults with liver cirrhosis, these are the patients who benefit the most of the hepatitis vaccine. Household contacts of those with hepatitis A or B, homosexual men, chronic recipients of blood products, and intravenous drug users. Specific indications for hepatitis B A vaccine: travelers. When you travel to certain areas of the world where hepatitis A is so endemic, you need to get vaccinated against hepatitis A. And specific indications for hepatitis B vaccine is going to be what? It's going to be us, the healthcare workers, patients on dialysis, and recently diabetes has been added to one of the indications for hepatitis B vaccine. Sadly, there is no vaccine for hepatitis C. There is no post-exposure prophylaxis for hepatitis C either.